Assalamu alaikum. Today we are going to study the venous sinuses and arterial supply in this model. This is anterior cranial fossa, this is middle cranial fossa, and this is posterior cranial fossa. Now if we move to the venous sinuses, the sinus present at the margin of lesser wing of sphenoid. This is Spheno-parietal sinus, which move posteriorly and ultimately drain into cavernous sinuses. This is cavernous sinus, which in turn move backward and drain into sigmoid sinus and transverse sinus by two sinuses, the superior petrosal sinus and the inferior petrosal sinus. Here inferior petrosal sinus is present. The inferior petrosal sinus is not shown as a sinus here, but inferior petrosal sinus is present. If we look at this is occipital sinus and this is superior sagittal sinus. The occipital sinus, superior sagittal sinus, and the inferior sagittal sinus all drain into sinus. This is known as confluence of sinus. From the confluence of sinuses, the two sinuses emerge. The main continuation is the right transverse sinus and the other is the left transverse sinus. This is sigmoid sinus, which drain into the internal jugular vein. Moving towards the blood supply, the brain has dual blood supply via vertebral arteries and anteriorly internal carotid arteries. This is the anterior spinal artery, these are vertebral arteries, and this is posterior inferior cerebellar arteries. The two vertebral arteries, they combine to form the basilar artery. This is basilar artery. The inferior portion of basilar artery gives two branches: anterior inferior cerebellar arteries and labyrinthine arteries. The labyrinthine arteries move towards the internal acoustic meatus with facial nerve and vestibulocochlear nerve. Moving upwards, this basilar artery gives multiple pontine branches. In upper portion, it further gives two branches: the superior cerebellar artery and the posterior cerebral artery. These posterior cerebral arteries contribute to the formation of circle of Venous between or just almost at the level of cavernous sinus. This is cavernous sinus, and it gives posterior communicating branches which communicate with the branches of internal carotid artery. The internal carotid artery, which is not shown here, give anterior and middle cerebellar artery.